Diagnosis typically involves a combination of medical history, physical examination, and sometimes additional tests. Medical history: doctor will likely ask about your symptoms, including any pain, discomfort, bleeding during bowel movements, and changes in bowel habits. They may also ask about your medical history and any risk factors for hemorrhoids, such as constipation, straining during bowel movements, or family history of hemorrhoids. Digital rectal examination (DRE) in this procedure. The doctor inserts a lubricated, gloved finger into the rectum to check for any abnormalities, such as enlarged hemorrhoids or other rectal conditions. Anoscopy, a procedure that involves using a small, flexible tube with a camera anoscope to examine the inside of the anus and lower rectum. Sigmoidoscopy or colonoscopy. These procedures involve using a flexible tube with a camera to examine the entire colon and rectum for any abnormalities. Barium enema, a special X-ray examination of the colon and rectum after the administration of a contrast material. Barium, to help detect any abnormalities. Colon transit study. This test evaluates how long it takes for food to move through the colon and may help identify any issues contributing to constipation or other bowel problems. In some cases, other tests are also required. Stool guaiac test, fecal occult blood test. If there is bleeding associated with hemorrhoids, doctor may recommend this test too. Check for blood in the stool that is not visible to the naked eye. It involves collecting a stool sample, which is then tested in the laboratory. Ultrasound or MRI. In some cases, imaging tests like ultrasound or MRI may be used to evaluate hemorrhoids. Blood tests, complete blood count, CBC, HB, LFT, etc. Treatment depends on the severity and the type of hemorrhoids, internal or external. Treatment options can range from lifestyle changes and home remedies to medical procedures or surgery for more severe cases. Here are some common treatment. Lifestyle modifications. Fiber-rich diet, eating foods high in fiber, such as fruits, vegetables, whole grains, and legumes, can soften the stool and make bowel movements easier, reducing strain on hemorrhoids. Hydration. Drinking plenty of water and fluids helps keep stools soft, making them easier to pass. Regular exercise. Physical activity can promote regular bowel movements and reduce pressure on the veins in the lower rectum. Medical procedures. Rubber band ligation, a common procedure for internal hemorrhoids where a small rubber band is placed at the base of the hemorrhoid. This cuts off blood supply, causing the hemorrhoid to shrink and fall off within a few days. Sclerotherapy, injection of a chemical solution into the hemorrhoid tissue to shrink it. Infrared coagulation, IRC, a procedure that uses heat to shrink the hemorrhoidal tissue. Electrocoagulation, this is an electric current stops blood flow to a hemorrhoid. Minimally invasive procedures. Hemorrhoidectomy, surgical removal of hemorrhoids, usually recommended for severe cases or large external hemorrhoids. Hemorrhoid stapling, this surgical procedure involves using a circular stapler device to remove excess tissue and reposition the remaining hemorrhoidal tissue back into its normal position. Home remedies. Warm sitz baths, sitting in warm water for 10 to 15 minutes several times a day can help reduce pain and swelling. Ice packs, applying ice packs or cold compresses to the affected area can help reduce swelling and discomfort. Over-the-counter, OTC, pain relievers. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or acetaminophen can help relieve pain and discomfort. Over-the-counter, OTC, creams or suppositories, these may help relieve symptoms such as itching, pain, and swelling. They usually contain hydrocortisone or witch hazel. Thank you for watching my video. For more videos, kindly like, share, and subscribe.